Welcome to Offgrid Victory. So today I want to talk to you about something important for the homestead. I would call it insurance, if you will. And so if you live off-grid, if you live remote like myself, sometimes access to medical care could be very difficult. And sometimes it's very hard to kind of get the medical access you're going to need. And so let's talk to you about that today and some of the things I have on the homestead. So just my particular background, I was a first responder EMT for many years, as well as a crew chief for my squad. And so yeah, I've seen a lot of things medically over the years, personally for myself as well as the people that I help treat. And one of the things I can honestly say is you never want to end up at a hospital. For me personally, I would not step in the doors of a hospital unless I was hit by a Mack truck or something traumatic, trauma-based happened to me, whether I was forced to go. But living off-grid the way I do, living in a rural community, it's very difficult to even get that sort of access. So in essence, I try to treat most of the things on hand. And with the current state of affairs in the world globally, even access to medical care is difficult. I mean, there's shortages in terms of prescription medications, and yeah, just access to people, right? Like, nobody wants to actually work. So anyway, with my rant being said, what I want to talk to you about is not the actual equipment, but today we're going to talk to you about this product from JASE Medical. And so, I live rurally and I live on an off-grid homestead. I like to first treat everything that I have first aid needs for on a herbalistic basis if I can, right? But sometimes what happens is you get one of these things where it is a true life and death kind of an emergency situation where you really do need Western medications and Western procedures. And so one of those things is antibiotics. And so I'd like to talk about antibiotics today. And so yeah, I mean, truly you can't say every sickness is related to bacteria or parasitic kind of infections. I mean, you have viral infections, right? And so that's not the video today. For viruses, I mean, this is a product that will be ineffective. And that's one of the contraindicators for the use of antibiotics in general. You don't want to use it for a viral infection. So, things like colds, it's not going to work. Nor should you take it, because what happens, just like what happens in hospitals, is you get bacterial and bacterial strains that are resistant, right? Like MRSAs and things like that, and staph. And so you don't want to overly use medication. And in this particular case, antibiotics in the Western societies have been way overused. So this is literally an emergency, a last-ditch effort, especially for a guy like myself. And so, I would recommend this product highly, but I would use it very precautionary. I would make sure that I read all the literature and I did all the research. And they do provide, JASE Medical does provide a very good resource, which I will go through in a bit, in a moment. So with all that said, I just wanted to say and disclose that what I'm going to try to do is get an affiliate link for you and a discount code for you in the description and post that to JASE Medical. If you want to go ahead and skip the rest of this review, I would just say I would recommend it. I would get it if you can afford it. But let's go ahead with all that said and how I'm going to use it on my homestead and some of the things I would use it for, right? So by no means this is medical advice. Go to your primary care physician for all of that good stuff. Use it at your own discretion, at your own kind of risk, right? So anyway, let's get started. So this is what they provided in this JASE kit, this JASE Medical kit. So what they provide is 4 different antibiotics here. and a nice little emergency antibiotic guide, and some literature with it, right? So this is what you get plus the literature. And so I'm going to quickly go through some of the contents of it and how I would use it, right? So first of all, this is all for an adult usage. It's for a one-time usage, and I would recommend highly that you take the full course, because you don't want to add to the resistant bacteria that are out there and make things ineffective for others as well as yourself, right? So make sure you take the full course. And so this is 1 full dose of amoxicillin. This one is erythromycin. This one is ciprofloxacin, and this is dioxicillin, and the metronidazole. Okay, I don't know if I pronounced that one right, but at any rate, this is what you get, and the various uses for this is also covered in this really handy medical guide here, antibiotics guide. For me, I just went ahead and I just color-coded it, as well as taking out my name and the prescription numbers, just for privacy. And so anyway, there's amoxicillin. It goes through some of the things that you would need, some of the things that it can help out with, and I'll quickly talk about that. But I wanted to show you the book first. So I just color-coded it. It's nice, it's useful. Respiratory infections, UTIs, various kind of bugs, parasites, you know. Anyway, gastrointestinal stuff. So let's quickly go over the contents of it, right? So once again, it's for one person. The course of medication per tablet, it's written down right here, so very easy. It takes 1 tablet per mouth twice a day for this particular amoxicillin for 14 days. So there's 28 tablets in here. So the contents is for a full course of these antibiotics. You want to take all of them and take it the way it's prescribed. Like here for the erythromycin, it's 2 tablets once a day, then 1 tablet on day 2 through 5. Okay, so there's basically 6 tablets in here. So follow the directions very carefully and use it for their intended purposes. Use it all. So one of the things that I want to talk to you about here for antibiotics is the common use for it, like I said, is not for viral infections. Not for viral infections. So don't just use these antibiotics if you are unsure or don't know what you have. That's what doctors do, right? So don't just overly prescribe yourself or self-medicate. So JASE Medical will have a professional that will allow you to go ahead and get these medications. It's actually very non-intrusive, I thought. The only thing they kind of want you to do is provide them with a government ID, like a driver's license, and that's really for their own protection. But ultimately, you know, we still have HIPAA laws here in the United States that protect your privacy. But the form itself, in terms of the medical things that they asked for, really isn't that all intrusive, and it was very well done and tactfully done, right? I didn't have to go to a doctor's office or, you know, have one of my doctor's friends, you know, prescribe some of this stuff for me, which, you know, they would do, but honestly, I don't want to bother them and risk maybe losing their medical license over it for me. So anyway, these are the things that I really like about this company, that, like I said, it is fairly non-intrusive. You know, it's basically just providing a driver's license and answering a few questions for your safety and for theirs, right? So anyway, I would do that. And like I said, without going into all the finer details about each one of these antibiotics work, I'm just going to give you a general idea of what they do and how to use this thing. And so let's just go through one of the color codes that I did here. The red one I put just as amoxicillin, and that's commonly used for, you know, respiratory issues, I mean, sinus issues. I'm sure if you have children like myself, over the years, your your pediatrician's probably prescribed that a zillion times, right? It probably makes it ineffective, but at least you have it. And of course, with all of these antibiotics, the main contraindicator is if you're allergic to it, right? So if you know you're allergic to penicillin type of drugs, well then amoxicillin isn't for you. So make sure you know those things. And you know, I got to say it again, this is not medical advice at all. It is YouTube after all. Take it for what it's worth. And so yes, the next thing I want to talk with you about is this right here, erythromycin. That's prescribed a lot for GIs overseas, right? And for all sorts of things like you know, diarrhea, things like that, that are common overseas with various bacteria and parasites that are out there. And the next thing is Cipro, and you know, ciprofloxacin is very famous because if you knew anything about 9/11 in those days, anthrax, I guess, supposedly went around a lot with the U.S. Post Office. So Cipro was one of those things that was overprescribed back then. But it does have uses. And one of the things I want to say about Cipro is these are one of the few antibiotics where the side effects is death, right? So this is why you don't treat antibiotics like candy. I mean, these things can kill you if you don't use them correctly and for what its intended purpose was, right? So Cipro is one of those things, and so I would be very precautionary about it. So any of these fluoride-based drugs, I mean hydrogen fluoride, one of the most caustic, nerve-damaging materials that only eat through your skin, right? And of course, they make other drugs like hydrofluorosilicic acid, things like that, commonly known as fluoride. So at any rate, don't get me started on that stuff. But take that really with precaution. And of course, this is probably the thing that I would use most because, you know, I would have need for any of these tetracycline type of drugs, this dioxycycline, because of the things that are around me. So we have ticks all over the place. Now, I'm probably immune by now by all the diseases that the ticks carry, but somebody may not be. So this is very useful for that. Of course, the other thing is, you know, when working outside, working with tools, hand tools, you're gonna get stabbed with metal things. And so tetanus, that's a big one. So for tetanus, the full measure of dioxycycline, and this one you get a lot of pills, and you just, you know, take one a day for 60 days, right? So the thing with this is, and with any of these antibiotics, is you don't want to skip a day. You want to be diligent about it, and you don't want to double up, let's say, if you missed a day. So that's a no-no. So anyway, that's a precautionary thing. And of course, other things in terms of contraindicators, if you're pregnant, if you have any other drug interactions, like if you're taking other medications, definitely don't take any of this stuff with alcohol. And those are some of the things that are contraindicators. Now, we just talked about the side effects. Most of these are pretty well tolerated. You know, you might get diarrhea, you might get nausea, you might get headaches, normal stuff, some little light inflammation, stuff like that. But there are some really serious side effects of some of these things, like on the Cipro here that I just talked about. So don't take the stuff lightly, and, you know, take the full recommended dose. If you have any questions, go ahead and call JASE. They have a phone number provided that they give you that you can contact a physician to talk about this stuff. So at any rate, yeah, that's kind of the things that I would say. In terms of the way I'm going to be using it as more of a prepper, one of the things you definitely don't want to do is, you know, leave this and expose it to the elements, right? So for storage, you want to keep it dry. You want to keep it in a dark, cool place. But the main thing is you don't want any moisture to contact this medication. And so the worst thing that can happen is for this medication to freeze, and then they'll just become ineffective. And so, or water, of course, right? Because it'll just break apart. And so those are the main considerations. So for me, most likely what I would do with this is I'm going to go ahead and use this Mylar bag here, label it when I received it, and I'm going to bury it below the frost line. Why? Because it won't freeze, and it'll keep a constant like 50 odd degrees. It's not exactly the most optimal temperature to keep these medications in, but you know what? It's pretty good. I mean, it's basically keeping it in your keeping it in a very mild refrigerator. And so 50 degrees for me is going to work. I'm going to go ahead and bury these. Like I said, this is only going to be used in a true emergency, and maybe in a true grid down situation. And so the next thing I want to talk about quickly is just shelf life. Now, there's been studies out there that, you know, say that antibiotics are good to X amount of years, like 10, but honestly, you know, when this is sent out to you, their advice, and that's for their liability as well as yours, they tell you basically it's good for 1 year. So these were dispensed in June, and they're going to be good for June of 2022. And I've went ahead and I've marked these June of 22 when I received it. So when I bury this, it's going to tell me that, hey, it's effective for at least a year, right? In those kind of ideal conditions. And with those conditions, it'll go way longer than that. Now, with that said, you don't want to take any kind of Western medication past expiration if you can avoid it, because sometimes the compounds will degrade into poisons, right? So, you know, is it good for these long dates that some of these prepper sites and some of these researchers have said? I don't know. I mean, honestly, that's something that I can't really comment on because, you know, I've never taken a really expired drug like that. But in a grid down, you know, situation where it's life and death, it might be worth the risk reward to do it. And so this is JASE Medical, and I really would recommend it for those guys who want that insurance. In terms of cost effectiveness, yeah, I would say it's cost effective if you consider other things. I mean, there are cheaper options. You know, I know people consider fish antibiotics because essentially they are the same by the same manufacturers, but that's not always guaranteed either. And the doses in the dosage recommendations are not always correct on those, especially for human consumption. So truly, this is the best, the antibiotics that are out there for preppers, for homesteaders like myself, to readily have on hand. So if you ever require or encounter a medical emergency, you know, you could take care of it yourself, because we all want to be self-reliant, self-efficient, sufficient. And so this is a product that I would recommend, and something to have on the homestead. Alrighty, shalom.